Welcome to the Attention Deficit Disorder Expert Podcast Series by Attitude Magazine.
Hi, I'm Susan Kaufman, and you're listening to Attitude Magazine's ADHD Experts Audio. Today's webinar is about procrastination. It's the bane of existence for many adults with ADHD. And as Dr. Russell Ramsay, our guest today, points out, the hallmark of adult ADHD procrastination may just be this phrase or one like it. Hey, I know what I need to do, but I just don't do it. Dr. Ramsay is Associate Professor of Clinical Psychology at the University of Pennsylvania's Perelman School of Medicine, where he is the co-director and the co-founder of the Adult ADHD Treatment and Research Program. His program has been in existence for over 15 years, and he has worked with hundreds and hundreds of adults and college students to manage procrastination and cognitive function problems. He's a specialist in cognitive behavior therapy for adults with ADHD and the author of two very interesting forthcoming books. One for professionals, Cognitive Behavior Therapy for Adult ADHD. This is the second edition of a professional treatment manual on that topic. And for the rest of us ordinary folks, a patient guidebook to cognitive behavior therapy. It's called the Adult ADHD Toolkit. Dr. Ramsay, thank you so much for joining us today. We're very grateful for your time. And let me turn it over to you.
Great. Well, thanks so much. In a nutshell, I just want to talk about some of what goes on neurobiologically that can make follow-through more difficult for folks with ADHD. Hence, the focus on procrastination today, which seems to be, there's a lot of different coping skills, organization, time management, but for us at Penn, procrastination really seems to be at like a meeting point where a lot of them come together in terms of real world problems. So just want to give a template for how do we understand procrastination. Also want to talk about how we conceptualize procrastination and intervene to help people not procrastinate. Most people who come to our program for an evaluation and treatment, most people will say, I know exactly what I need to do. The coping strategies aren't new to me. I know I need to use a daily planner. I know I need to be better organized. I know I need more time management skills. I know what I need to do, but I just can't do it. Usually followed by, so what are you guys going to be able to do for me that any other book or another therapist hasn't been able to do? And our answer over the years, having worked with a lot of people, is twofold. One, we think we're pretty good at helping people understand how they don't do things. Not just, oh, you waited too long and you have to file an extension for taxes. Guess what? You procrastinated. Or, here, you need to be better organized. You already know that. But understanding how ADHD affects all of these things. So understanding in a step-by-step way how you procrastinate or how you ended up missing the deadline or what have been the difficulties with instituting a daily planner. And then with this understanding, with all those different pivot points that can tip one way or another, either being on task or off task, following through or not following through, that's where we can do the interventions. Now, that being said, a phrase we use a lot, and I'll probably use a lot today, it's not just the cognitive behavioral skills. And again, we all know the skills. There's that focus on how do I implement the skills. So we do a little wordplay where we differentiate between the coping strategies, which we all know, versus the coping tactics that help us use what we know we need to do in that moment. So to get an understanding of why some of these things are so hard, ADHD, the name's not going to change. But we know the A and the H are red herrings in a way. They are features of ADHD, but they don't tell us enough. Well, how can you say I don't pay attention well enough? I was able to read Hunger Games in one night, or how much activity is too much? We're really understanding ADHD now as a problem with self-regulation. So that's what helps us understand what causes all the problems somebody may have in day-to-day life. The executive function model is a very scientifically rigorous one, but also a very helpful one to understand what's going on. And we like Russ Barkley's definition of it, and Tom Brown's done a lot of work in this too. But the executive functions are those behaviors we do to ourselves to self-regulate. And self-regulation means choosing and enacting plans across time towards a goal that you want but for which there's not immediate enough payoff. And using that definition with a gentleman who came in for an evaluation with us during his feedback session, he slapped his knee and said, "That's it. My boss always tells me if he needs it from me in 5 minutes, if he needs it from me in 10 minutes, he gets it in 5. If he needs it from me in 2 weeks, it takes me a month." Because the 10 minutes, the end point's right there. There's motivation all over the place. Drop everything, get to work. It's very salient. 2 weeks, it's just as important. The person knows it, but there's not that compelling drive to have to necessarily start today. I'll start tomorrow, or I have time over the weekend, or I still have a whole week. And that's how it creeps up. And that's how procrastination can creep up on somebody. So one, there's problems related to the executive functions. The executive functions can pretty much be boiled down to a single factor. How efficiently do you do what you set out to do? But drawing from the Barkley Deficits and Executive Functioning Scale and some other research, and this is useful clinically to understand what's going on. Again, helping people understand how they don't do stuff. There's time management issues. And when we talk about time management, it's not just managing time. In terms of managing time, we're organizing behavior across time, which means we're managing tasks. We're also managing our effort and energy, to do these things. There's self-organization and problem solving, self-restraint or inhibition, self-motivation, and motivation in executive function terms is the ability to generate an emotion about a task in the absence of immediate consequence. It's being able to start studying for the midterm 4 days before the test as opposed to the night before, where there's motivation all over the place. It's anxiety, it's panic. It's being able to generate enough feeling that I don't want to walk into the test unprepared so that we can start studying at least a little bit. Then lastly, emotional regulation. You won't see emotions anywhere in the official diagnostic criteria, but we know that ADHD is associated with difficulties managing the same emotions anybody has when facing a stressor, but they can be more disruptive, more distracting for somebody with ADHD and more likely to knock them off task. There's also a line of research looking at ADHD as a reward deficiency syndrome, and there's many other models that converge around this, but for simplicity, I'll focus on one. There are other regions of the brain where dopamine affects functioning. We're used to the prefrontal cortex, the higher order functioning, but also deeper in the brain, there are some reward centers where we get our felt sense of reward, of a job well done, of enjoyment, where this explains why folks with ADHD, it's not an attention deficit per se, but it can be an attention and effort allocation problem because it's harder to generate the emotion to generate these positive feelings, or at least some feelings associated with a priority but somewhat mundane task that's important, as opposed to something that might be more immediately enjoyable. Now, in terms of our prefrontal cortex, the outer region of the brain, we logically know I really have to do homework. I really have to get my taxes done. But subcortically, sort of like the gut level feeling, that's where that overrides that higher order. We don't feel it. Yeah, I know I should be working on this, but let me take care of this other thing first. Then I'll be in the mood to do this more difficult task. So that's part of the battle, and that's part of what drives procrastination. And again, this is summarizing some work by Nora Volkow showing that adults with ADHD have less available dopamine in some of these reward centers of the brain. So it's just starting off for things that mundane but necessary tasks. And they're not always mundane. Sometimes it's things that we want to do, like exercise, work on an art project, develop, work on an at-home handyman project, or handy person, I should say, that we say, I know I enjoy doing this, but it's difficult to do. It helps explain why it's hard to follow through on even some things that we want to do. Even some of the findings about dopamine, It's lower in these regions for adults with ADHD, and measures of the dopamine availability in the brain also correlate with questionnaire measures of trait motivation. So when there's less dopamine in the brain, somebody filling out a questionnaire about motivation, they'll endorse things showing lower trait motivation, so how the biology maps onto the psychological. Well, this is all very nice and good, but what does this mean for day-to-day life? This helps explain some of the motivational deficits often encountered in adult ADHD. Trouble getting activated, getting started, being more prone to boredom, not being able to latch on to something, generate enough emotion about a task to get engaged, and a harder time sustaining attention, sustaining engagement. A sense of being lazy or insufficiently disciplined. These can be the cognitive attributions after time. Once we have more and more difficulties, how do we explain this? Well, it must be me, and it must be my character. And all this means that individuals are more likely to engage in and do best with salient, interesting tasks that have more frequent or more salient rewards. So this can result in intense novelty seeking, maybe a little bit of risk taking, the increased risk for chemical dependency, and what we see more and more, non-chemical addictions. And we should say that in quotes. We're not trying to add another diagnostic category, but people will come in to say, I have a hard time getting off the internet, getting off the computer, to interrupt the game to go do these other things. It's hard to disengage from that thing that I find enjoyable to do these other things that I know are more important. So that was just an all too brief synopsis of what's going on in the brain. In terms of procrastination, let's come up with a definition. And the next slide will show a definition that I really like from Piers Steele, who did a wonderful professional article, and I think he has some popular books on the topic. Procrastination is to voluntarily delay an intended course of action despite expecting to be worse off for the delay. We put it off knowing we're going to pay the consequences later. But that's part of what's difficult about delay of gratification, doing what we know is most important now. And the different facets of procrastination, and you can see many common facets of ADHD in here too. Difficulties with distractibility, organization, prone to boredom, problems when there's a delay in reward. And I half-jokingly say the last one, decreases with age, pretty much tells us if you put things off long enough, you'll eventually grow out of it. But, and procrastination can seem to skeptics of ADHD like, well, this is everybody and this is just a little nuisance thing and you just have to do it. Well, procrastination can be very devastating because people miss out on job opportunities. They have academic delays. There are financial consequences to this. There are probably some healthcare consequences to not paying attention or following through on signs of some health-related problems. So it can be a very important life problem. So what do we try to do about this? So in terms of our cognitive behavioral therapy model, and there's a lot of other wonderful cognitive behavioral therapy for adult ADHD programs out there, and there's a lot of overlap in terms of all the coping strategies we use, and I know a lot of what I'm talking today about the implementation of these skills, all the other programs like ours, they agree with what I'm going to talk about today, even though we might have our different takes on things. So the four components that I want to discuss are the cognitive modification, how do we change thinking? Behavior modification, that's ultimately what it's all about. Do we do things differently? There are some specific research on implementation strategies, and then acceptance, mindfulness, persistence, which is a bundle of a couple different buzz phrases talking about managing the uncomfortable emotions that you will face when facing tasks that you typically procrastinate on. As I mentioned before, there's a combination of strategies but also tactics that we use to implement the strategies. And you know what? This is where we're trying to emphasize action over intention. And that's like another way to think about ADHD. It's intentions, best intentions, but not followed up with actions. And one of the things that we use in sessions and we highlight in the ADHD toolkit that'll be coming out are written takeaway reminders of what to do, writing them out. having a reference point so that we can turn our intentions into manual behaviors that we can do, almost like a recipe. And I joke, I'm a psychologist, so I can't prescribe medications, but I can write behavioral prescriptions. So, starting off with cognitive modification, what do you think? And there's a lot of research really showing how it used to be thought any negative thoughts associated with ADHD could be explained by coexisting anxiety and depression, but we're really finding out now that adults with ADHD, there's a whole strand of negative thinking that exists even apart from these coexisting things. The number one, anecdotally, the number one cognitive error we see associated with procrastination is magnification and minimization. In anticipating a task, again, something that you know you want to do, that you have to do, that you'll be better off for doing it. It could be homework. It could be filing taxes. At the outset, we start psyching ourselves out. We start magnifying how uncomfortable it's going to be, how futile the task is going to be, questioning our ability to do it, and how the time on task is just going to be awful. It's going to go on forever and ever with no positive outcome. Then we minimize our ability to tolerate some time-limited discomfort to get started. Once I get started, most people will say it's usually not as bad as I think it's going to be. Our efficacy, our ability to manage the task well enough, the value of the task and the value of the time spent on it, and the process involved in reaching the outcome, meaning most often we don't have to wait to the end of the 30 or 45 minutes on task to feel some relief. Usually once we get engaged, we start feeling better about it. It's like, okay, I'm started, I'm doing this, I'm making some progress, this is good. So part of the work in therapy is to change the negative to positive ratio. You don't have to be all in. It doesn't have to be 100%, oh boy, I can't wait to do taxes. We just need a few swing votes just to get the vote 51 to 49 to be able to get started. And one metaphor we use, and this is like one of these ways we try to make treatment sticky, meaning this all sounds great in a consulting room with a therapist, but it's how do we do this out in the real world? The notion of a defense attorney. So this cognitive error, we reframe that. It's almost like there's this prosecuting attorney trying to make a case against doing the task. Your Honor, it's going to be awful, it's going to be boring, it's going to be fruitless. And what we say is, so often we'll give up on a task, not because it's not important or we can't do it, but only one argument, the argument of the prosecuting attorney gets presented. You need to think through, what would your defense attorney say? Still based on the review of the evidence, but at least for a time being suspending your doubt about your ability to do the task and thinking through, well, it's usually not that bad and I can work at least 15 minutes on this. Just little reframes enough that we can get started. And this is not the power of positive thinking, because gamblers are very positive thinkers, but it's not very adaptive. We're trying to be more adaptive and realistic. But also part of that realism is that, yeah, you'll probably feel better doing, we underestimate the positive feeling associated with getting things done. Even taking out the garbage, unloading the dishwasher, we might not be jumping up in the air, punching the air, saying Yahoo, but we usually feel better. It's just like this, I got that done. But that speaks to also the behavioral side of things, which is in the next slide. What do we do? How do we follow through? This is one of these coping strategies that we all know. Break down the large task into component steps. But how do we do that? And especially if we have a strong procrastination script for not doing stuff like homework, exercise, whatever, we want to understand in detailed terms, what is my old behavioral procrastination script? How do I procrastinate? So this could be somebody who wants to go to the gym, comes home from work and says, I'm going to go to the gym, but they get a snack, turn on the TV, and then their motivation melts away and they, quote unquote, find themselves skipping a trip to the gym because now I'm too tired, I'm not in the mood. Well, there's a whole script that almost through association primes somebody to not go. They go home, they get settled in, they start watching the TV. Now, all of a sudden, it's really a huge hassle to go work out. So we want to understand how those behaviors sort of go together to train somebody each day not to go and come up with a new script. So how do you come home if you want to go exercise? Do you come home? Maybe you take your gym bag with you to work or to school and then go right away after work. Or if you do come home, rather than getting a snack right away, maybe you grab an apple or something, but then you go upstairs and change into your workout clothes. Nothing too shocking, but it's how we put it together and how we implement it to sort of change the associations and have more behaviors that are going to prime follow through. And with all these things, the bottom of the slide where it says behavior over emotion, trying to make the task as manual and behavioral as possible. Have a start time and an end time to a task. I'm going to spend 15 minutes, 30 minutes on this. I'm going to start at 10 a.m. and stop at 10:30 because it's easier to start a task if you can see when it's going to end. And then if you look up at the clock and say it's 10 o'clock now, when the big hand is at the bottom, I'll be done, and then I can go do something else. That's a whole lot different than I just have to keep doing this until taxes are done or until all my homework's done, because that's unrealistic. We don't do stuff we like sometimes for that long. So it's in trying to make things manual so we can do them, even if we're not in the mood to do them. How would you unload a dishwasher? What do you have to do? You can start with the bowls. You can, sort of flip them together pretty quickly, and now your sort of top rack is halfway done. Even if you're not in the mood to do it, you can make your arms and legs do what they need to do. These are not immutable laws of physics. We can always violate them. But what we want to do is procrastination becomes this overlearned automatic behavior. So we want to make something that's automatic explicit so we can see the steps as you're doing them. And then from that, we can come up with an alternative script. Now, the issue there is, and we're going to move on to the next slide, time management. There's a lot that goes into that. And like I said, time is also task management. Tracking the flow of time, it's tracking behavior across time, managing effort and energy. So all these behavioral interventions are meant to address each of those things, having shorter increments of time, more specific behavioral follow-through, a starting point, a point for re-engagement, and this also helps us prioritize, and I like the phrase, how we choreograph tasks. So moving from one homework assignment to the next, and then maybe we take a break for a little bit, or in the course of a day, where does our exercise fit in? Maybe the beginning of somebody's workday, they do the more difficult creative work. Then later on in the day, maybe some tasks that don't require as much higher order thinking, like checking emails, whatever. So there's a lot that goes into the behavioral interventions. It's not just just do it. It's how do we do this? How do we get engaged? And also, how does this one task fit in with the choreography of the day? The implementation strategies. How do you get engaged? And we could tie this in with the behavioral a little bit. So there is a line of research on implementation intention strategies, which posits that you can achieve some degree of self-regulation by delegating action control to pre-specified critical environmental cues. Pretty much what this says is it's almost like cognitive rehearsal. So going back to the example of somebody who wants to work out, but they're at risk when they come home of procrastinating. So we would say, like using an if-then statement. If I can get home and then grab an apple, then go upstairs and change into my workout clothes, then I can go to the gym. That planning, not just saying the words, but having it tied in with the environment in which you're going to be. When you walk in through the door, it's most likely going to activate, now if I can get the apple and go upstairs. And again, it's not impervious, but research, at least with children, has shown it increases follow-through on homework and other things. And likewise, we've sort of modified it to say, well, if we can identify a tipping point for not doing stuff or getting off task, we can come up with if-then statements to deal with that. If I hear my cell phone, my smartphone vibrating with a new text message, then I can remind myself that I can finish my time on the task before I check it and it'll be okay. And again, it's not going to solve all impulsivity, but it increases the likelihood that we're going to stay on task and to implement and stay engaged on a task. So rather than having a goal, I have to do homework, we can have an implementation plan about how we're going to get engaged and stay engaged. And the research sort of shows that having an overarching task goal, but then having implementation plans for how to get started on that goal, because sometimes the goals are too big. Do homework for economics class. We might have to break it down to, if I can read the 8 problems in the problem set, then I can get started on number 1. it sounds basic, but a lot of effective behavioral principles are basic. It's a matter of doing them and having, and the implementation strategies, these were studied on children with ADHD. It hasn't been studied on adults with ADHD, but we find it to be very useful clinically. So moving on to the last set of interventions. These are all done within a cognitive behavioral framework, but we assimilate them. And I'll say with about mindful acceptance, or what we call, managing the emotions. And I'm sure this isn't a true emotion, but we find the most influential emotion with procrastination. We call it UGH, U-G-H. It's usually not like a panic attack about doing something. It's just more like, I don't feel like doing this right now. So we don't do, in our program, we don't do like mindfulness exercises. Alexander Phillips in Freiburg, Germany, who has a wonderful CBT program that's very well researched, in their group programs, they will do a mindfulness exercise at the beginning of each group. For us, we sort of weave together a bunch of different things. One is acceptance of discomfort. Rather than thinking that you must be stress-free or be in the mood to do a task, recognizing, hey, I don't feel like doing this, I'm feeling a little stressed, but I can accept this feeling, but still implement what I need to do to get started on the task and maintain a commitment to a valued task. I can commit to the 15 minutes, 30 minutes without having to be in the mood. The mindfulness is again, recognizing emotions. This goes back to how emotions can be even more disruptive for folks with ADHD than without ADHD. So sometimes recognizing the effects of your ADHD symptoms. You know what, I was sitting here working, now I caught myself staring out the window for 5 minutes. Rather than getting frustrated and saying, okay, I blew it, that ruined my plan. No, being able to go through and say, that's ADHD, it's a good thing I caught it now, I'm feeling a little flustered, I'm not sure if I want to get engaged in this, so I can notice how I'm feeling, and let me come up with a specific implementation plan. Let me read the last paragraph I was typing before I got distracted. It's a way to get engaged, lower the bar to make the task more manageable rather than, I have to catch up or I have to make up for lost time. Again, you can manage emotions without escaping them. In fact, there's a line of research saying that simply stating and acknowledging what you're feeling helps to reduce the firing of the amygdala or the emotion sensor in the brain. So again, the takeaway point from this last section dealing with the emotions, the ability to feel discomfort and still engage and persist on a task. So rather than escaping the feelings and getting relief through procrastination, because that's what's so reinforcing about procrastination. We escape right away and we get relief. But that reinforces procrastination. We want to reinforce being on task, that I can get re-engaged in task, get some measure of emotional relief. Once I get started, it's not as bad as it was when I started. And that reinforces on-task behavior. Now, none of these things are a silver bullet that's going to allow us to, then I'll never have to worry about procrastination again. It is something that you might have to go back to and do on purpose. Again, do it manually. But you know what? I ran across a great quote on persistence recently that said, persistence is not one long race. It's a series of smaller races put together. So, before we move on to the question and answers, that's sort of what we tried to do here. One of the things that we observed in our clinical work, most people when they procrastinate, they're not necessarily going on Facebook or doing something fun. They might be not working on the term paper or the essay or the monthly reports from work, but then they might say, well, I'll mow the lawn now. That's important and I need to get it out of the way. And they're going to another chore, but very often what we see with that chore is, one, it's physical, it's manual. Two, there's more of a predictable cause and effect. I know if I mow the lawn, within plus or minus 10 minutes, I'll be done in an hour. And it is something that needs to be done. So in dealing with procrastination, we sort of took that and said, well, these other tasks that we know we want to do or we have to do, how do we break them down to make them in a similar fashion and deal with the negative thoughts that people have? So I know this is an all too brief nutshell of what we do over several sessions and what we've developed over several years, but it's sort of a framework on how we think about procrastination. And again, if you can see procrastination, just like we say with ADHD, the executive function models and other models helps people see the impact on day-to-day life more than attention or hyperactivity does. And then once we can see it, we can start finding out its effects and then intervene at those moments to do things differently. And that's what it's about. So
this is great, Dr. Ramsay. I just learned a couple of wonderful tips just from listening to you. The whole idea of minimizing that negative, catastrophic, thread in our heads. And then the implementation plan idea is also really helpful. Instead of saying, I must do X, say, if I do this, then that. I mean, I think that was super, super helpful.
Right.
I think it's something that I do myself without having characterized it that way. I sort of say to myself, all right, in order to do the taxes, I'm going to do this and this first.
Yeah.
Sort of, it's a form of, because boy, that doing the taxes, that's.
I always use that as an example.
Yeah.
Well, it's a great one because we know it has to be done. There's no surprise about when it's due. It comes the same time every year. But it's not very fulfilling. They're confusing.
Nothing fun about it. Yeah.
It's
I'm
not
always astonished by people who do it in April. I'm like, you do your taxes in April? Why didn't you wait till October the way I do?
Right.
Before we talk maybe a little more about tips, and there are a number of questions about that, maybe we could go back for a second. There are some questions about how ADHD relates to procrastination specifically, as Jennifer is a person who wrote, everybody procrastinates. What is it about ADHD that makes it a more prevalent problem with people with ADHD?
Two things I would say about that is first about procrastination. Yes, we all delay things from time to time. If we want to call it, if we want to frame it as procrastination being a clinical problem, it's where there are ongoing, regular and ongoing negative effects of the procrastination. And again, we can all miss a payment now and again, but for folks with ADHD, the difficulties generally differ in number and severity across time, where we're talking about frequent lateness to work or missing deadlines at work or for other things where it has an impact on grades or academic standing or even getting kicked out of school or whatever. So it is one of these terms that you're right. We all struggle with these things, which makes this a very appealing topic. And as we were talking about before this started, I find myself being a much more efficient person just, working with many adults with ADHD and seeing how difficult it is to do stuff. What makes it even more prominent, or let me just say different with adults with ADHD. People who are anxious may procrastinate, particularly if there's performance anxiety. People who are depressed may procrastinate because there's a negative anticipation of, this isn't going to work out or I'm not up to this right now. So procrastination is pretty ubiquitous. I think with ADHD, again, and this is one of the things where people will say, doesn't everybody have ADHD? If we're looking at ADHD as a developmental syndrome, these things persist across time. They're not just part of a specific mood episode where they get worse. And secondly, there's some of the imaging slides I was showing before. There seems to be a constitutional difference in the amount of dopamine available in the reward centers, in the prefrontal cortex, in other regions that make it more difficult to shift from being off task to on task. So even if somebody doesn't have depression, doesn't have anxiety, there are many of these things that are going to be more at risk for being put off longer and more frequently and more likely to result in negative life outcomes for the individual, despite knowing full well that I should do this earlier. So that's sort of a brief answer for how it fits with ADHD differently, and just the continuum from the procrastination that we all do, we put off or we skip a day at the gym, versus we let our gym membership lapse because we just stopped going.
Right. Okay. So interruptions seem to be a key issue for people with ADHD in general, and there are a number of questions about that. How do you handle, what's your advice for handling interruptions and getting back on task? You mentioned several examples of difficulty with getting back on task.
Right. Yeah. The first is, as much as is possible, trouble avoided is a problem solved. And I know no setting is going to be perfect, but selecting where we try to do tasks. And I'm thinking more about maybe in the workplace or students who are studying. And I also appreciate a workplace that's multifaceted. We could have a professional athlete in an arena. We could have a contractor working out of his or her truck, or an office worker. But if we can try to set out the environment in a way to be more ADHD friendly, or I should say distraction reduced, again, that's good coping for anybody. Now, even if we do as well as we can to set up or to set out a task in an environment that'll be distraction reduced, I think this is where the implementation strategies, once we find, part of it is, one, if there are risks for being drawn off task. So that could be a cell phone ringing, a landline ringing, a notification that an email has come through, a knock on the door, a child coming in asking a question. We can't avoid all these, and some of these, like, attending to our children, they are priorities that jump the line. But after we attend to that, it's recognizing that we're in a transition point for, I still have this task undone. How do I define what's the smallest point of behavioral engagement that I can define to get me back into task? And if we're assuming we're most likely going to be not in the mood to do it anymore since our concentration got broken, sometimes, again, specific behavioral manual things that you can do to touch the task again. So this could be a student reading something. It might be going back and let me reread the paragraph that I just finished reading before I was interrupted. Or if I'm writing, let me go back and reread what I just wrote, like the last paragraph. Something you're not adding anything new to the task yet, but you're going back into something that might be easier. So it even might be if we get interrupted organizing stuff around the house. It might be, what is one thing I can do right now that's going to help me complete another organization task? It might be moving a pile, something, I call it touching the task, getting back on so it's hands-on again as much as is possible.
Yeah, I think one of our coaches has recommended, if you can, jotting one or two key things down before, if you have to stop in the middle of a task in order to help you get back on track.
With writing, and that's a great tip, because like with writing, there's a nice tip that don't stop writing until you leave yourself a reminder for what you want to write next. So that way when you go back, rather than having to say, I wrote well last time, but now I'm facing a blank screen, no, we can go back and parenthetically say, just jot down a phrase about, here's the next point I want to make. That way it just sort of leaves breadcrumbs. And so even if you have time before leaving your desk, it might be, let me reach a good stopping point, and then when I come back I can do this. Yeah, so it's right in line with that suggestion. It's a great suggestion.
Okay. A couple of people, Jeanette, Barb, have talked about feeling overwhelmed. It's almost paralysis from an overwhelming set of demands. So and this I think is a very ADHD sort of feeling, very hard to prioritize or to figure out which one to start with, and just a feeling of paralysis from not being able to get started or differentiate between all the tasks at hand.
Right.
Are there any strategies that you recommend for that awful overwhelm paralysis?
Right. And what I'm going to assume for a moment, just for answering the question, sometimes there might be something, if there's something like that is the obvious priority, like it's April 15th and taxes are due at midnight or something like that, then we just got to be honest with ourselves and find the entry point. But let's just assume even any prioritization we do, it's sort of 6 of one, half dozen of another. It's sort of up to us. You know what? In a way, I would say in that case, action is better than inaction. So choosing something. And for one person, this is where we talk about with our program. This is where we want to personalize the interventions, but without rationalizing. So meaning one person, their starting point might be, let me start off with easy stuff, checking emails, doing a couple logistical things, and then that's sort of their warming up for the bigger stuff. somebody else, it might be, you know what, I'm freshest when I get there, so let me do the biggest thing first. Then later on in the day, I can do more administrative tasks. I don't have to think as hard. And some people are a mixture of let me do a little of this, a little of that. So that's where we personalize it, whatever works, but without rationalizing it. Because somebody could tell themselves, hey, let me do the emails first. That's like my warm-up, but it's actually an avoidance strategy. And one other thing, I was working with a gentleman one time. What he would do is like write out like on little slips of paper, like a couple of the different priorities, and then just put them in a little bag or something and just pull one out and do that. Or you can flip a coin. Yeah. And you know what? Flip a coin, and if you find yourself rooting for it to land one way or another when it's in midair, you've already made your choice. You know what you want to start with.
Right. That's a great idea. Just take the whole priority setting issue off the table and have it be done.
It's trying to make it more behavioral than emotional. Even though, yes, this is where the emotions can be overwhelming. And you know what? Sometimes the thought can be, oh, I have to do all these things, but we also know we can't do them all at once. We can do them consecutively. And usually, and this goes back to that phrase I find myself using and other people using, once we get started in one thing, we start feeling better. And now it's like exposure for anxiety. Once we're facing the monster, it's not as scary. And now we're getting things done and we're building up our efficacy, our confidence.
Right. A big strain of perfectionism is being mentioned. Bill says, no, I just put tasks off because I just don't think I'm going to be able to complete them to perfection. And another person said, I just know that I'm going to do this badly. Here says, I procrastinate because I know I'll fail in doing something well enough or in a timely manner. So anxiety and fear are just a huge factor.
And you know what, in thinking through the whole perfectionism issue, and this goes back to Steele's art review of procrastination, and that wasn't about ADHD in particular, but where he said it's really, he didn't see as much perfectionism in his review, and it got me thinking, so let me take one of the other ones first, though. In terms of the fear of failure, well, sometimes then we could look at, well, what are the expectations for doing it well enough? And what that means, because this can result in like quasi-perfectionistic behavior of trying to get everything done in the first draft and going back and editing the first sentence at a time, which is draining. And in a way, it is pulling back. And say with writing something, again, stuff we all know, but it's the implementation. It is, the first pass, getting all the ideas down, having a free write and not worrying about grammar yet and everything, and then having the sequence where we go back and tidy up the wording and then write for, cutting and pasting and all that. And even before that can be the outlining. And I use a wide definition of outlining. It doesn't have to be Roman numeral 1, like capital letter A. There's a lot of different ways to brainstorm stuff. And also to challenge the thoughts about like the standards that will be applied. And just looking at, we just have to do well enough. And part of that is shrinking it down to let's just get the paper done. Now, going back to perfectionism, there's also a question in my mind because in the Steele article, he said it's more impulsivity than perfectionism. So in some ways, going back to the emotional regulation issue with ADHD, and this could be totally wrong, it's still a hypothesis, but that the perfectionism, and what is that? We try to get things done right, perfectly, the first draft. And in a way, that's emotionally protective because if we're getting it done perfectly, then I don't have to worry about it. And it could be sort of like a compensatory strategy trying to avoid the stress of, I don't know, is this good enough? And so there might be more emotional stress that gets in the way of starting earlier. And again, it goes back to this tolerating the discomfort to get started on something that we don't know yet how well it's going to be. Now, this is where cognitive therapy, we can have our defense attorney say, well, how often in your past has the paper or the project or whatever been so bad it hasn't been accepted? And some people might say, well, doctor, there have been these times that somebody said, you're going to have to take an incomplete and redo this or whatever. But even there, we can start working at, all right, how did you handle it before? And are there ways you can handle this task differently this time to have a different outcome? Again, just trying to get engaged at the moment and get engaged earlier.
Yep. There's 3 or 4 people on the webinar who are either working with or living with someone who they're watching be paralyzed by procrastination. So it's a child or it's a spouse, or in one case we have a college writing instructor on the webinar who says, I deal with students who just tell me they just couldn't write the paper. And they're wondering, what can they say to help? What's the best thing that they can do as a friendly outsider for either their child, their spouse, or in this case, a student, when they see them paralyzed in this way? They find it very difficult to watch and wonder what can they do to help.
You know what? In terms of, I'm just pausing on the what to say, because most of the things, but most of the things that we'll have to say, and they're well-meaning, and again, it's the stuff that we all know. So I would say maybe if there is a way to sit with somebody and sort of be a shadow with them to help them get started, or and the thing with like with the writing and homework, because, and this can be where there's that emotional overwhelm that leads to writer's block, or the person says, I can't even focus. Just talking through somebody about breaking a task down. And I think schools are getting a little better with this. I hear more and more assignments where it's like your outline is due on this date, and then your first draft that date, and get your topic approved by whenever. They're trying to teach how to handle these tasks. But going back to, if you can sit with somebody or even just engage in conversation. Hey, don't worry about writing. Just tell me what your paper is about. And again, how we stumble onto this stuff clinically, one of my most successful sessions with a patient one time, with his permission, same thing. He was procrastinating on this paper, and I said, don't worry about writing it. Just tell me what it's about. Tell me what your ideas are about it in any order. And with his permission, I recorded it digitally and then gave him the recording. But he found himself outlining the paper as he was talking, which, talking is a behavior. Speech is a behavior. Again, how we can turn a task into something that we can do. And this is why I think voice-activated software can be helpful for a lot of people. Or even if somebody's alone, I know I do this, knowing the research on ADHD and language and whatnot. If I'm alone in a room and I'm stuck on how to phrase something, I'll say it out loud like I'm telling somebody, because we can usually do better conversationally than we can do in a writing component. So these are just different ways to get unstuck.
That's just so true. I mean, we know from our webinars that professionals who write for Attitude, who have a terribly difficult time writing, are just so articulate when they're just speaking, and it's just, so here's a person, Rebecca, who said, I've often found that just having someone start the project with me helps me get motivated. So I think the suggestion of helping someone by talking it through with them is great, because that also, I guess, breaks the big ball of terror, which is all wrapped up and doesn't have pieces. So it's a really good idea. Really good idea. I mean, something about writing, I think, is especially anxiety provoking. A question about the inability to to estimate the right time involved in a task. Any suggestion? I mean, we see that, so many people say that that's a big impediment for getting something done. They underestimate, they overestimate, they just don't have a good sense of how much time it really is going to be.
Yeah, and two things there. One is, when we're talking about the task, what are we talking about? Is this somebody who goes into it saying, again, I'll use writing, the paper's due tomorrow, so I have to write the whole paper today? Or have we broken down the task already, where we say today's task is I need to get the 5 articles that I have to cite in the paper? So sometimes it can be, how are we breaking down the larger task into the component steps? Because the more specific we get in those component steps, probably the better we'll be able to estimate the time. And even if we say, well, I'm doing this for the first time, I'm trying to do this project differently, but I still don't know, just sort of some guiding principles we use is, generally I would say, don't count on doing something, plan on doing something for more than an hour. Now, if somebody says, you know what, I write and I know 2 hours is my window, if it already works for you, don't listen to me. But if somebody's still trying to figure it out, it's empirical. So one person might say, no, an hour's too much. It's about 45 minutes for me. Somebody else might say 30, somebody else 90. But don't start with anything more than an hour. And I would say at the outset, if you're starting to implement some of these ideas, err on the side of a shorter time rather than more.
Okay.
15 minutes, 30 minutes. And what can happen now, if we're juggling a bunch of things, sometimes we don't have this flexibility, but usually what might happen if we set out like 15 minutes to do something, but then we get on a roll, we get engaged, that might turn into 23 minutes, 35 minutes, and that's fine. But, at least starting off with a start time and an end time, it's sort of like being able to see the shore. You can pace yourself for where you're getting. It's like when it's this open-ended thing or like planning to do something all day, we don't do stuff we like for that long, much less like chores and whatnot.
Although, interestingly, both starting and ending are problems for people. I mean, people have mentioned both of those.
Right.
Picking the start time and then ending. I just want to comment here from Richard. He loves the example of mowing the lawn because it's his go-to task in order to avoid other tasks that lack the beautiful clarity and definitive outcome of mowing the lawn. And he wonders if mowing the lawn is prevalent with other ADHDers. It's a great
that would be in the next revision of DSM. It'll be something
exactly.
Like that. No, but I mean, what's helpful about that is when we're doing it, sometimes we can say, am I mowing the lawn because this is my priority right now, or am I escaping something else? And sometimes we'll still mow the lawn. We'll go, and that's progress. When I'm working with somebody, very often the process is I procrastinate and I don't know why I keep doing it. Then we do all the template. Then somebody will come back and say, Dr. Ramsay, I knew I was procrastinating as I was doing it. And I still did it. But that's progress because now you caught it earlier on, and even if you still fell into it, and what will happen is, over not too much longer, there'll be like one of those pivot points where you go, you know what, I don't have to change my Facebook picture right now. Let me get back to this other thing. And again, it's not like we shift these things around. It's not like we turn into 100% non-procrastinators. Let's just say we procrastinate 80% of the time, and we can turn that into, hey, I'm on task 55% and procrastinate 45%. It's not 100%, but I always tell people, if we invented a medication that had these results, we're billionaires. That could change it like 35%. People are lined up outside the pharmacy. So sometimes we think behaviorally, but I'm still not perfect. Well, nothing's going to be perfect. That goes back to the one commenter who said, don't we all procrastinate to a degree? Absolutely. But we're talking about trying to reduce the harmful procrastination that results in lost opportunities. And the goal of all this, I always want to make this clear, this doesn't mean that you have to graduate from a certain college or have a 6-digit salary or something like that. This is just being able to follow through on whatever endeavors are important to you. This could be stuff with your children. This could be stuff that you say, hey, I always wanted to paint a painting or something, and I've never followed through with it. However you define it, but it's just meant to be able to follow through and actualize yourself and just have more satisfaction.
Again, I can totally see that, once you recognize that what mowing the lawn means, it could really help you move forward, despite going ahead and mowing the lawn. I mean, Shayna says doing the laundry is her mowing the lawn.
Exactly.
Productive procrastination.
Absolutely.
So, people would love to hear more about cognitive behavior therapy. How many sessions do people tend to do? How do you find a cognitive behavior therapist? Is it important that a cognitive behavior therapist be familiar with ADHD?
Right.
Can you talk a little bit about your profession? I think it's of great interest to people.
Cognitive behavioral therapy is a form of psychotherapy that was originally developed as a treatment for depression and has been applied to anxiety, a bunch of different things. And our group and others adapted it for adults with ADHD. One of the benefits is it tends to be a more structured therapy, really focused on problem solving, coping skills. It doesn't mean like we're robots in session that we just come in and say, have you done this or not? It is collaborative and interactive, but we're looking at, making changes in today's, your day-to-day life. So there are, many good cognitive behavioral therapy organizations, the Association of Behavioral and Cognitive Therapy, the Academy for Cognitive Therapy. However, I would advise it is good having a clinician familiar with ADHD. So this is where you can go on like the CHAD, National Resource Center, and look at some of their hospitals and programs, maybe the Attention Deficit Disorder Association. But you know what? We don't have a good clearinghouse for, people specializing in adult ADHD. Like NYU has an adult ADHD program. I think Duke University has one, University of Pennsylvania, Harvard. Well, you know what? Mary Salanto just moved to NYU, so I'm not sure what Mount Sinai's program is going to be right now.
Oh, right.
It could still be there, so look it up. I'm not trying to...
Okay. We're trying to assemble a directory on attitude, and it's a slog, but there really isn't one place where really you can find all the resources that people would want to live with ADHD and learn. And so we're working away at it. And
another thing you can do is we have our treatment approach published, and we're coming out with a second edition. Steve Safran and the Harvard group have the Mastering Your Adult ADHD, both the therapist manual and the client guidebook. And Mary Salanto has her cognitive behavioral therapy for adult ADHD group program, even though it can be modified for individual work. Susan Young in the UK and Jessica Bramham, they have 2 editions of their approach. So those are the ones I'm familiar with that have been published in English and are available. There's one in Finnish and one in German. But, those, so if you find a good therapist or a good cognitive behavioral therapist, those might be good ways that, somebody that you're comfortable working with can read up and apply some of these things in their work.
Yeah, it sounds like the professional toolkit that you're publishing would be very useful if you found a good cognitive behavior therapy that need to learn more.
Well, that and the Safran one and all the other ones I mentioned. But yeah, we did, like I said, a lot of what we put in the toolkit stems from this top. Yeah, we have a couple chapters on procrastination and everything else, and it's all about the implementation.
Okay. A last note from Lauren says he or she, I'm not sure, has a picture that says begin, and that helps her daily. Once she starts, she gets started. The problem is... But it's probably... But I think that what might happen, and I'm not reading Lauren's mind, but it could be that reminder to shrink it down. You know what? Stephen Covey, the 7 Habits of Highly Effective People guy, he had a nice quote. He said, begin with the end in mind, which I think is great. Part of his principle-centered approach, know where you're going to help get you started. But I always wanted to add to that to say, but so begin with the end in mind, but you got to begin with the start in mind. You have to actually get started with the smallest first step. I think that's a paralysis invitation.
Exactly.
Person. Wow. Yeah. Well, thank you so much. There's just a flurry of thank yous being posted. What a great presenter. Thanks, Dr. Ramsay. Dr. Ramsay rocks. So this is my first webinar, and I look forward to many more. This is extremely helpful. So thank you again. And I hope we'll have you back. You have such great insights into how this works and what we can do to tackle it. Thanks, Dr. Ramsay. Bye, everyone.
For more Attitude podcasts and information on living well with attention deficit, visit attitudemag.com. That's ADDITUDEMAG.com.